Hi, I'm Rene Fiechter. I direct community affairs for Nassau County District Attorney Kathleen Rice, and I'm former chief counsel of the National Treatment Alternatives to Street Crime. And today we have a challenging group of people, highly experienced, to talk about a problem that's extremely serious on Long Island, and I'm talking about the heroin crisis. To my right, we have Jamie Bogenshutz, who is the past president of NAFAS and the current executive director of the YES Community Counseling Center of Massapequa. Hi, Jamie.
Hi, Rene.
Hey. And also we have Patricia Hinken, who is the executive director of NAFAS and as also the executive director of the Long Beach Memorial Medical Center Drug and Alcohol Treatment Programs. So, good morning, both of you, Patricia and Jamie.
Thank you.
First of all, what is NAFAS, Patricia?
Okay, NAFAS stands for the Nassau Alliance for Addiction Services, and we are a organization coalition of 30-plus providers, both treatment and prevention providers in all the communities across Nassau County, including community-based organizations and hospitals.
That's really quite a network. Is there also a Suffolk counterpart?
Yes, there is. It's called the Quality Consortium of Suffolk County. So they also are a similar organization of treatment and prevention providers in Suffolk County, and we work also closely with them on Long Island region issues.
Well, the question that everybody has at this point, given the vast network that you both have been representing and are currently working in, is there a heroin problem on Long Island?
Yes, there is. It's a very big growing problem. On Long Island, we, of course, focus on Nassau County, our alliance of treatment and prevention providers. It's mainly been fueled by such an increase in the rise of prescription medicine for pain management, mainly opiates, including like a Vicodin, Percocet, OxyContin. We've seen a trend of increased prescriptions by doctors and also having it diverted onto the street. And we're finding that youth are getting them out of medicine cabinets, and they have what's called farm parties, and where they take handfuls of pills. And what's happening is that then they are becoming physically dependent upon these medications, and then find that they're very expensive. And from there are dealers just waiting to step in and say, okay, heroin is much cheaper. Instead of $40 a pill, you can have it for $7 a bag. And the youth are told that you can just snort it. You don't have to put it with an IV in your arm, so it's not really such a big deal. And then as the more heavily addicted they become, then they say, you know what, if you put it in your arm with a needle, it'll be much better high, and then we just keep a downward spiral, and that's what we're seeing.
It's a frightening trend. Jamie, people have said that Massapequa at one time was considered the epicenter. Is that true, and what are you seeing?
Well, I certainly think that the southeastern corridor of Nassau County was really heavily affected by heroin use, and I think we came into the forefront of the headlines when we had the deaths of many young people. And, you know, I think the community at large, not just the southeastern corridor, but I think the community at large was just so surprised that a drug like heroin could actually be in, you know, middle, upper class communities, because that's just not the perception of this drug. You know, I think when we think about heroin, the common perception is that, you know, there are these, you know, these derelict looking like people who have, you know, needles dragging out of their arms, who are just, you know, doing awful, horrible things. And the reality was that we had these terrific young people who were vibrant, who made some really poor choices and died. And I think that shocked the community at large.
And Jamie, again, are you seeing larger numbers at this point? Are we winning at all?
You know, it's a tough question, because I think what we're seeing in our community, and I think this is probably common amongst most of our treatment providers, is that it's not that we're seeing this tremendous emergence of heroin users. We're seeing more kids And we continue to see more kids who really are coming in around issues of alcohol and marijuana use. And that's how they get to us most times initially, unless, of course, their use has, you know, in the community has really just been so long and so protracted that they're getting to us when they already have a pretty significant prescription pill history and heroin use. But heroin, you know, again, we're not getting those kids as heroin users. Very often we're getting the kid, you know, we're getting young adults, that 18 to 25 range. And prescription pills are really the biggest issue of concern for most of us in our, you know, in the system.
You know, you just raised the issue of prescription pills, so I think that might be a good segue. You know, Patricia, Patty, you've been very much concerned about the prescription pills and some of the needs for changes in legislation. What have you observed as a problem with prescription pills?
Well, one of the issues is that people begin taking it under a physician's care. Oftentimes they are getting multiple sources of the medication, and we find as we're working with a patient that we have to look at where are all the pills coming from, what medical uses are they. Often doctors don't know about each other. Sometimes they're crushing and snorting their pills. But even doing that, they still feel that, well, if a doctor gave it to me, it's okay. So it's very hard to work through that denial system when someone feels that they have a prescription or a medicine. So that is one of the obstacles. Once they start using heroin, then it's a little bit more difficult for them to maintain, you know, that denial system. But in Long Beach Medical Center, I'd say maybe because we do have an inpatient detox, that I would say we are seeing an increase in the numbers coming to the hospital of people that are using opiates and heroin.
You know, all of us have been in this field for some time. This is not the first time we've seen a wave of substance abuse problems on Long Island. From the 60s when marijuana first hit, in the 60s, and then the psychedelics, and then the heroin came in for its first round, and then and then later crack, and then cocaine and crack cocaine with the whole disco world, and here we are all over again. What is really different this time around than has been in the past waves of drug abuse that we've seen? Jamie?
You know, I think one of the things that Patty touched on, which is a real concern for us, is that number one, certainly the heroin is far more pure than it ever was before, and so the effects of it are much more lethal. And in addition, it's more accessible. You know, kids can get it, and they can get it very cheaply. And so, you know, those are two very, very significant issues that we struggle with all the time.
Well, it looks like we've hit on a really good issue, and I think we're going to want to catch up on that again. So we're going to take a little break, and we'll be right back with you.